Welcome to the last virtual learning session for Pacific Women, the last for this calendar year. Just a word of thanks for attending our previous virtual learning session and all the other virtual learning sessions that we've had over the few months. For today, our topic is the impact of gender equity and social inclusion in the public sector and the benefit of implementing family and sexual violence policy in the private sector. Joining me today, we have Shabnam Hamid and Ellen Maines from the International Finance Corporation. Shabnam is online. I have Ellen here in person with me. They both will be discussing the IFC study on the impact of family and sexual violence in the workplace. We also have with us online Amanda Robbins. Amanda Robbins is with the Equity Economics. She will be discussing the findings from the report, Gender Equity and Social Inclusion in the Public Sector. So just before we have Shabnam come on board, I'll just give a bit of introduction on Shabnam. Shabnam Hamid is Global Lead Workplace Responses to Gender-Based Violence for the International Finance Corporation. She is an employment specialist with 20 years of experience spanning the public, private, and not-for-profit sectors. She has worked in developing and emerging markets, including in Africa, East Asia Pacific, and South Asia. She leads IFC's Respectful Workplaces program. And then Ellen here, who's with me today. Ellen is an operations officer and gender advisor who leads projects to close employment gaps between men and women in Myanmar, Fiji, and Papua New Guinea by demonstrating the business case for the private sector to invest in gender equality. Ellen leverages her extensive experience and connections across the private, government, and NGO sectors in the East Asia Pacific region to tackle challenging problems and projects. I'd like to invite now Shabnam to start with her presentation.
Thanks so much for that wonderful introduction. I'm just going to share my screen and see. Can everyone see that?
Yes, we can.
Fantastic. So today I'm going to talk about a study that we undertook to discover whether there are benefits to employees and businesses when companies respond to family and sexual violence. By implementing policies, procedures and training and subscribing to support services such as GESI for victims and survivors. So we undertook the study in November 2020 among employees at 3 major companies in Papua New Guinea. So today I'll present the results from the first round of research, which provides a benchmark for measuring the business case for workplace responses to family and sexual violence. We're currently undertaking the midline and the endline data collection. The final data collection will happen around this time next year, and we'll have further results to share with you in 2023. So to undertake the study, we partnered with Business Coalition for Women to carry out this project. You're all familiar with Business Coalition for Women, I hope. It's a non-profit organisation that was established in 2014 by IFC with seed funding from the Australian government. Business Coalition for Women aims to help the private sector and PNG to recruit, retain and promote women. So our study is based on a workplace survey with over 1,400 employees from the 3 companies and interviews with 23 staff. As I said, the research was conducted in November 2020. The companies involved operate in the financial, hospitality and transport sectors and have recently introduced support for employees that are affected by family and sexual violence. And this covers developing and implementing a family and sexual violence policy, training a group of staff to assist employees affected by violence by referring them to appropriate services, and also to helping them to make reasonable workplace adjustment. By this I mean linking them to entitlements such as special leave to deal with issues arising from the violence. The companies have also been raising awareness among staff about family and sexual violence, how it impacts work, and where to get help. And these three companies all subscribe to GESI. They pay an annual fee to GESI, PNG, making their employees eligible for emergency accommodation and referral to GESI case management. So case management means that the employees receive support to access the many services that are required when experiencing family and sexual violence. So what did our study find? Our study found that 43% of all respondents, so all employees aged over 18, had experienced violence within their lifetime. More women than men were affected. Of these, nearly half had experienced violence in the last 12 months. 88% of those affected by violence experienced emotional abuse, harassment, or intimidation by a family or household member. 80% were threatened, and 72% were physically assaulted by the family or household member. All respondents to the survey, 81% said that they have friends or family affected by violence. So family and sexual violence affects all income and educational backgrounds. We found that family and sexual violence affects all roles from frontline staff to middle management and senior management. Those who experience violence most commonly identified family or unrelated household members, and then current or former intimate partners as the perpetrator. 44% reported they lived with their perpetrator. 48% of perpetrators were men, 30% were women, and the rest were unspecified. So they might have said a household member, but not specified the gender. 52% of survey participants affected by violence noted that anxiety, depression, or shame about the violence were the main barriers to getting or staying at work for a full day. They also reported feeling drained or taking time off for matters arising out of the violence, such as attending court hearings, or feeling stressed due to the perpetrator's jealousy towards work colleagues. Family and sexual violence also happens at the workplace and can compromise workplace health and safety. 23% of all survey participants reported that family and sexual violence had affected their ability to get to work, be safe at work, and perform at work at least once. And COVID has heightened these impacts. And all of this is creating a cost to business. Participating companies lost around 10 days per employee per year. So we averaged out the cost amongst the workforce. So these figures represent how much it costs per employee, whether they'd experienced violence or not. So 10 days per employee per year, and this equates to, just for these three companies, US dollar 2.1 million, or PNG Kina 7.3 million per year. On average, 4.82 days are lost per employee per year due to employees working less productively, due to feeling tired, distracted, or unwell. 0.4 days are lost per employee per year due to employees coming to work late or leaving work early due to the violence. 2 days are lost per employee per year due to employees missing work because of the violence. And 2.19 days are lost per employee per year due to employees supporting colleagues in an unstructured way, where employees may have inadequate information about how to respond to violence and how to attend to self-care. However, seeking help in the workplace often leads to positive outcomes. So staff reported that positive things happened after telling a human resource officer, trained staff member, or manager about the violence, compared to when they told a co-worker or an employee who was not trained to handle their disclosure. There are early signs that measures recently introduced by the three companies, such as implementing family and sexual violence policy and training the team of staff to support colleagues, and the subscription to GESI are making positive differences. Survey participants affected by family and sexual violence most commonly received workplace support through paid time off, counselling, and referral to GESI case management. Staff who'd experienced violence in the last 12 months were more likely to receive and access these supports compared with participants who had disclosed violence more than 12 months ago. And these staff over the last 12 months have also found the responses to be more helpful. This indicates that companies' responses to family and sexual violence are strengthening. A study also found that there's a correlation between the gender balance of the workforce, the level of support the companies provide to family and sexual violence, and positive outcomes. So this was actually a really exciting finding. What we found was where companies were more gender balanced, there was less acceptance of family and sexual violence. So the employees said that family and sexual violence is never acceptable. They reported that. They also reported higher levels of family and sexual violence. So in the survey, there was much more disclosure. But despite disclosing violence more, fewer days were lost to the impacts of family and sexual violence. And so there was a reduced cost of business, and there was more helpful responses to the disclosures of violence. So the research indicates where men and women comprise between 40 and 60% of the workforce, acceptance of violence is up to 8 percentage points lower. Reporting of violence in the survey was up to 6 percentage points higher, but the number of workdays estimated to be lost to the impact of violence was lower, and remarkably lower, up to 8.67 days lower per employee per year. Fewer employees at these companies said their employer could not help them when they disclosed the experience of family and sexual violence. So a real strong link between gender balanced workforce and positive outcomes. We believe this is the first study of its kind globally to establish that more gender equal companies which provide workplace support for family and sexual violence yield more positive results. And our findings have informed the following recommendations. Okay, our first recommendation is to implement good practice workplace responses through introducing a family and sexual violence policy to support employees experiencing violence, and also assisting employees through trained, supported contact team. So these are our focal points who work as a team around family and sexual violence. And the team would refer employees to relevant services and help them make reasonable adjustments at work to improve their well-being and safety at work. The second recommendation is around encouraging employees to use these available supports. So you need to have the policies and procedures in place first, and then employees obviously need to use them. This encouragement can be provided through leaders modelling respectful behaviour and also encouraging their employees to disclose family and sexual violence, and through awareness raising activities and products. Companies also need to engage employees who may be perpetrating family and sexual violence, for example, by providing counselling or referring them to peer support and discussion groups. Companies can also support employees to improve their financial literacy and financial management, as financial abuse is a key part of violence, and financial independence is key to leaving violence. Companies can also subscribe to support services for their employees, such as GESI PNG. And finally, improving gender equality at the workplace is the cornerstone of addressing any form of gender-based violence as a workplace issue. Companies, as I said before, with more gender-balanced workforces that take steps to address family and sexual violence have more positive results, including less acceptance of violence, higher reporting, fewer days lost to the impacts of family and sexual violence, and more helpful responses to the disclosures of violence. So we'll ask the report to be circulated after this webinar and event. And as I said, we're currently undertaking midline check-ins with the participating companies, and we'll have further evidence collected next year and the endline report ready in about March 2023.
Thank you for that insightful presentation, and certainly it's good to hear about the link between having a gender balanced workforce and positive outcomes. I think that's refreshing news for everyone to hear. I'd like to pass it on to Ellen.
Thank you so much. It's really wonderful to be here today. It's also great to hear Shabnam present the findings of this study again, because I think that the findings are so very important for firms in PNG, and I think the recommendations are just so practical and helpful for firms who are looking to put in place interventions. But look, thanks for introducing me and for such a generous introduction at the start. As Gabriella said, my name's Ellen Mains, and I am the gender lead for IFC in PNG. I also work across the Pacific, so I also lead projects in Fiji. But why I wanted to say a few words today was I'm not presenting a study or research, but rather just to make myself known. I'm rather new to Papua New Guinea, and actually IFC are in the process of introducing a new women's employment project here in Papua New Guinea, and it's really important that we share with you what we're planning to do, because there might be some really nice overlaps or opportunities for us to work together with other organisations in this space. So as you can see from Shabnam's presentation, IFC have got a history of doing these kind of studies in Papua New Guinea and across the region to help build the business case for gender equality. So we know that there's various barriers to women's employment, one of them being gender-based violence, but there's other barriers as well. And one of those is around childcare. We know that childcare and other care responsibilities are a huge drain on women's time and ability to work. So one of the things we're planning in our new women's employment project is further thought leadership. The first piece we want to look at is a study on tackling childcare, and to really understand the demand and supply challenges for childcare in Papua New Guinea, so that we can help to understand what the business impact is on women's participation in the workforce. This is something we've already done in Fiji and across the region, and it's been a really powerful study to help mobilise different stakeholders to actually start to address some of the challenges. In Fiji, we're working with the government of Fiji now to establish some quality standards on childcare, which has been really, really important. So that's the first piece. It's a thought leadership piece. The second thing we're doing is around developing a centre for women in trades. So through some of our work with clients here in Papua New Guinea, we've identified a need to increase women's technical training and access to technical training. So a feasibility study was conducted some time ago. There was input from various organisations, including the Business Coalition for Women. And we found that there was both a need from companies' perspective to provide training for women, but there's also a need for supporting these organisations to create respectful and safe workplaces for women to be working within them. So we're working now as part of the new project to help design this Centre for Women in Trades. It will offer technical training as well as life skills training and other training to help develop women in the workforce in technical roles in the mining, extractives, construction industries. So we're very excited about that work. And the third thing we'll do is continue to work with firms. So we have a track record of working with firms here in PNG to support them in women's employment, and we'll continue to be doing that kind of work as well. It's important to us that we work with partners. So we'll be working with organisations like the Business Coalition for Women to help deliver this kind of support to companies who may be our investment clients or other organisations. But I'll finish up there because I know we've got a really interesting study to hear from Amanda on, and we can perhaps take some questions at the end. Thanks so much.
Thank you, Ellen. So I'll just give a brief introduction to Amanda before, Amanda, you join us and you can do your presentation. So Amanda Robbins has over 20 years experience in economic policy and international development, working at the most senior levels of the Australian government and across the Asia-Pacific region. Amanda started her career in the Australian Treasury, working her way to the Deputy Chief of Staff to the Deputy Prime Minister and Treasurer, the Honourable Wayne Smith. Amanda has advised governments in PNG, Indonesia, and as a consultant for the World Bank, developing new ways to address persistent economic and social challenges. So Amanda founded Equity Economics in 2013 and has since grown the firm to be a leader in delivering a more inclusive and impactful approach to economic policymaking in Australia and the region. So Amanda, I invite you to start on your presentation now. Thank you.
Thanks so much for that introduction and for the interesting presentations already. So hopefully what we hear today in this presentation, it actually really confirms some of the really important messages that we heard already, and IFC's research in particular. So this is, I'm going to share with today is actually a really large study, so I won't do it justice here, but of course we'll share the slides and research with you further after the event. So let me quickly work through just some of the high-level findings, because the exercise we really went through was trying to assess what the economic benefit of implementing PNG's National Public Service Gender Equity and Social Inclusion Policy in the PNG public sector. So the IFC presentation you talked about was fascinating for the impacts of violence on private firms. What we've done is really replicate and conduct very original analysis of the impact in government. And the reason we really wanted to look at this question was because as governments all over the world, and particularly in PNG, try and look at constrained resources, particularly in light of COVID, wanting to improve service delivery, the literature suggests that women and diversity in the workplace helps you improve service delivery, helps improve performance, helps improve productivity. And we wanted to test that in the PNG public sector. So it's quite a unique research exercise and a fascinating one that we got to conduct over the space of a year from mid last year. So let's go through the various components of what we actually did. And I'll keep the methodology really brief. It's really detailed in the report, but there was a range of things we actually did. And a couple of things that are really interesting were some of the case studies and focus groups, but also the public sector survey, which was a really revealing survey of public servants who you don't always get to hear from. But also we had full access to the payroll data of the Department of Personnel Management. So that's a very rare opportunity to have the human resource information of the public sector. So it gave us a real chance to look at things like pay equity in the public sector. So we did cover a range of pillars, there's 7 pillars in the 2013 National GESI policy of the PNG government. We've grouped them into 5 just to try and manage the scope of works. And I'll briefly cover some of the results, some of the headline results in each of these. So just some overarching positives that came from the report. And really, there's a few that were surprising and interesting. And really, the first one is that while women occupy just 36% of the total public service positions, and the data we have is from the end of 2019, in some levels, equal representation has been achieved across the various levels of the public sector. Unfortunately, they're largely at the more junior levels. And the positive we take from that around having more equitable representation at junior levels is that over time, we like to see that work its way through to all levels of the public sector. But as yet, it's quite uneven. The other thing that's super interesting, which we'll share some of the data on, is that on average, PNG is actually achieving amongst its national public sector pay equity between men and women. And really, that's when we look at the public service pay levels, 0 to 20. It's interesting because it shows that some of the pay reforms that have been undertaken in PNG public sector around merit-based pay, equalising pay between men and women, some greater transparency, it appears to be working. But when you look beyond the average, you do start to see some real gaps and some wage gaps that still are yet to be addressed in terms of pay equity in the PNG public sector. So some positive news, because not many governments can claim on average even pay equity. But when you look a little deeper, you do see gaps, particularly at junior levels for women entering the workforce, which is very hard to explain at low levels of skills and experience and unevenness on entry into the workforce. The other big positive is that the GESI training is contributing to high levels of support around gender equity in the public sector. And we'll talk a little bit more about the findings on that. Where we find huge opportunities for improvement and a way to go is really around women in leadership. And that is where we all know women are significantly underrepresented in the PNG public sector. They remain at just 25% of senior positions. The other thing that is the very inconsistent application of GESI policies across the public sector, and we include both at the national and subnational level. The other concerning feature, which has been discussed in the earlier presentation, is the experience of gender-based violence. And what the survey really found is the extremely high levels of it, both at work and impacting on work. And we'll run through a little bit of that data for you today. Now, the reason we're conducting this study of the public sector is partly because the PNG government is looking at renewing their PNG GESI policy for the public sector. This work will be informing that as it's developed for 2022, and we should expect to see that soon. The other thing is that as a major employer, the PNG government has a huge role to play in demonstrating what gender diversity can do for workplaces. So let's look at the first pillar that we really covered, which is employment and economic empowerment of women. And here, just some high-level results. Interestingly, over 2/3 of the public servants responded. They indicated they'd like to see more women in the workforce. More women than men wanted to see more women in management roles, but still very high levels of support for more women across the board. What's interesting, and in the earlier presentation, we heard about some of the correlations. We ran a range of regressions around the data that we had. And what we see across all the pillars is some real correlation between positive outcomes where there is gender diverse teams. So public sector employees who were working in gender balanced teams, so there are men and women in their teams, were 8% more likely to want more women in the workplace. So more open and accepting of gender diversity. So both males and females were also really interested in taking on greater management responsibilities. So really debunking this idea that women didn't want the leadership roles. In fact, they actually reported slightly higher desire for management responsibilities. Also of interest is that both men and women were supportive of more flexible work arrangements. So it's not a demand that's just coming from women. It's actually being driven by men in the public sector as well. So here's a little bit of the data that we present in the report. And this one's really around the distribution of men and women across the public sector. And it's here you can see that overall, women still only make up about 40% of the public sector. It's actually much worse when you include the provincial governments and provincial public sector and village law public servants. So you can still see there's still a way to go in trying to achieve distribution of women across the public sector. Here is the analysis of the gender pay gap, which there's a lot more analysis of in the report, but just suffice to say that you can see where there are large variations in pay equity. And it's particularly those junior levels, which are really hard to explain, but also in the higher senior levels. Some explanations of that, which we go into the report, is that in fact, women in the health sector, so when we looked at hospital pays, is really the driver at that PS level 18, where women are actually earning much more at PS 19 and 20. It's often being driven by a higher proportion of women in the public sector around the health and hospital employment. I won't go through all the recommendations for each pillar because we don't have time today, but I do summarise some key recommendations at the end. Some other areas which had some fascinating results were women in decision making. And interestingly, the survey said that 83% want to see more women in the public sector management roles. But 25% of women responding did actually feel that gender was impeding their career. So there is this deep sense of discrimination in the workplace, including in the public sector still. Here's another regression analysis. And this is where teams that were 22% more likely to report being motivated and positive about their team where they were part of a gender balanced team. They were 8% more motivated when immediately managed by a woman. So again, it goes to some of that interesting correlation around, does diversity have an impact on behaviours at work? And we're definitely starting to, these are statistically significant results, we're starting to see that gender diverse teams are actually having productivity enhancing effects in the workplace. So a really interesting study which we found and which we developed was around corruption and the impact that women have in the experience of corruption. So international literature really does show and has started to explore the correlation between transparency and accountability where you have gender diverse workplaces. Now, what we found here, because we wanted to validate that literature in the PNG public sector context, and we found that fewer women than men were actually being asked to participate in corruption. Interestingly, a high proportion are or across the board asked to participate in corruption, but 23% of men were asked to participate compared to 13.5% of women. So this goes to the literature which suggests that fewer women are being asked to engage in corruption and potentially provides a way to actually think about how diverse teams improve accountability and transparency in the workplace. So we also look at gender-based violence, and this is much more than what we're presenting here in the report. But again, we did very similar analysis to what was presented by IFC, but for the public sector. The days reported here across the reporting of absenteeism, presenteeism, so that's where people are actually attending work but not able to fully perform because of the experience of violence, but also caring responsibilities. And what we found for the public sector, and it's probably slightly more conservative in its results than the results we heard earlier and previous research that's been done in this space by ODI in PNG, that the total average day lost to gender-based violence was around 6.2 days per person per annum. And when we extrapolate that across the entire public sector, which is clearly a huge employer with huge wages bill, it actually equates to about 2.4% of the PNG public sector salaries bill is being lost through gender-based violence. So a range of other implications around the gender-based violence study is that just how few are actually seeking support and using the pathways that we know a big investment's been made in actually making services available. And we heard about a few of those earlier. But across the public sector, we're hearing just huge reporting that they're simply not accessing supports that are available to them. Health was another topic and pillar that we looked at, and here's actually where we found some really concerning results around the experience of mental health challenges of women in the public sector. And health at work is clearly important. The reason we look at it is because it goes to not just absenteeism, but it goes to your ability to perform at work and to function productively. And here we found that 16% of women and 11% of men actually reported their health as poor or fair. 57% of women and 40% of men reported they'd felt down, depressed or hopeless. And this is based on international standards around mental health and wellbeing questionnaires. We did have some questions on disability for those who are interested in disability. And so please do have a closer look at the report to cover disability as well. But 2% of women, it should be 4.5% of men reported having disabilities, which is well below the prevalence of estimates of disability across the population and suggests real underrepresentation of people with disability in the PNG public sector. Accessibility was reported as a major issue for persons with a disability as well across infrastructure in the public sector. 17% of women reported that there was access to breastfeeding facilities, but that's a huge gap for the remainder of public sector departments. So we also ran some analysis here of international comparisons around the cost of poor health on the performance of work and public sector work in particular. And again, here we find huge potential impacts on productivity at work around the equivalent of 135 million kina or 3.2% of the total wages bill. Again, there's some interesting analysis around people continuing to work when they're unwell. And there's a range of reasons that they give for that, but often it is a feeling of pressure to be at work. But also there are questions around how well they feel if they were to remain at home. So they often feel safer when they're at work. So education is another pillar we looked at. And here we're talking about education in relation to gender equity and social inclusion, not education at large around qualifications, because we're talking about the national GESI policy. And here, some really interesting correlations are around the effectiveness of GESI training in the public sector. So 87% of respondents that had received GESI policy training had applied lessons or self-reported as having applied lessons. So, but some interesting regressions around GESI policy training and awareness about gender-based violence and referral pathways. So those who'd actually completed GESI policy training in the public sector, they really benefit from a health and safety perspective. and they're far more likely to seek treatment when unwell, and they're actually reporting when they're more likely to seek advice, counselling, or support others as a result of gender-based violence. So it's really interesting, again, to see statistically significant outcomes from people who've conducted training around, been recipients of training on gender, on unconscious bias, and gender awareness training at work. They're actually seeing correlating results in terms of their preparedness to speak up at work, preparedness to report violence, and preparedness to access services. The other thing that we see correlation is that gender attitudes and behaviours are changing with education levels. So as public servants with postgraduate education, they were far less likely to perceive increased numbers of women in the workplace as causing potential conflict. So there is some correlation again between qualification and the support and level of awareness around the role of gender diversity at work. Again, some more interesting results around those who'd actually had GESI training. So where people had GESI training, they obviously have far higher awareness around their workplace policies on gender, in particular gender-based violence. So it's proving to be an important way to improve reporting and utilisation of pathways for help around gender-based violence. The other thing that those who had gender-based training, interestingly, are also far more likely to seek support and help when they experience violence. So some interesting conclusions that the overarching sections of the report actually find is that strengthening GESI interventions in the public sector does have significant potential to make savings. Now, we don't do GESI interventions purely for economic reasons. We do them for a range of important, both ethical, equitable, but performance reasons. But this report's really about trying to quantify the impacts to convince governments that actually this is an investment to continue to make because it has huge dividends. Here we actually found that between 100 million and 135 million kina can be saved through doubling down on some interventions that are in their existing policy, but intervening and extending them to more agencies. More ambitious reforms that significantly increase the proportion of women at all levels of the public service have real potential to reduce revenue leakage through the kind of reduction in corruption, improved productivity performance, greater attendance, reduced absenteeism. The aggregate effect well exceeds the entire current public sector salaries bill. So some conclusions that really go to the policy implications of the research. And please do look at the report to look at the recommendations list in more detail for each pillar. But the 5 or 6 top priorities, which we really have aggregated here, but are dealt in more detail in the report, are that there needs to be support for women in the public service, particularly in leadership roles. That still is yet to be addressed adequately, and the government's goal in that area have not yet been achieved. There needs to clearly be stronger action in the public sector on gender-based violence. Often employers don't necessarily see it as their role. It certainly is their role of the public sector when they've got reports of 60% violence of their workforce. There does need to be enhanced health services to improve mental health and the experience of people with a disability, and those with a disability being employed by the public sector. More comprehensive delivery of GESI training is clearly needed because it's having actual payoffs. So more extensive utilisation and delivery of training would be beneficial. Finally, there's huge support for adoption of more flexible, family-friendly work practices. There's appetite for it, and it has huge gains for the public sector performance that need to be considered. So I might stop there just because I've probably gone well over time, and really keen to take questions.
Thank you for that presentation, Amanda. Very insightful. And then, like I think you've said, diversity does have an impact on the workplace, something that the team from IFC has also found through the study that they conducted. So we'll go through the questions while Toby also just checks online if there are any questions from the participants. I do have a question for the team at IFC. So you talked a bit about, to Shabnam and Alan, you talked a bit about the setting up of contact teams, and this is one way that the workplaces can respond to FSV in the workplace. Are you aware of what sort of services are available for setting up the workplace contact team and also for putting in place policies and practices within the workplace?
Yeah, I can take that question if you'd like. So we were working with the companies that have subscribed to GESI. So when a company subscribes to GESI, they also get support around the policy development and around training the contact team. So the Business Coalition for Women will go to the workplace and help raise awareness about the issue. They can also help the company with adapting a family and sexual violence policy for the needs of that business and those employees, and also to train a contact team. And training a contact team is not about turning people into counsellors, in a few days worth of training. It's really about getting the team to understand what family and sexual violence is, how it affects work, and then how, in a survivor-centred way, to receive a disclosure. So how do you actually help someone? What do you say when they come forward with this issue? And then what are the kind of referrals that are available? So one immediate referral is to GESI, to case management, to emergency accommodation. But there's a whole bunch of issues that come up around family and sexual violence, and that could be, medical, it could be legal, it could do with child welfare, etc. And so part of the contact team training is really getting the staff members that are trained to understand the scope of what might be needed, and also, where the company can help and where the company should refer to experts. So, that's basically in a nutshell how it works. I hope that answers your question.
Yes, it did. I think it's important to emphasize here that we have trained counselors, and these are the best avenues for people who are experiencing FSV to be visiting or to be making contact with the team at HR and also the contact team that have been trained to be able to refer them to the services that are available. So this other question, I think it's for Amanda. So I think under the first pillar, you mentioned that there was a high percentage of respondents that requested more flexible work arrangements for both men and women, flexibility in the way that they work. And then I think further on in the presentation, you talked a bit about there was a high percentage of respondents, both male and female, who talked about feeling down, depressed, or hopeless. So I think my question to you is, when the respondents were asking for a bit more flexibility with the work arrangements, was this flexibility for themselves, or was it for maybe the opposite sex, or was the question asked in that sense? I just want to understand if both sexes are supportive of each other getting that flexible working arrangement.
Yeah, it's a really good question. And the question was asked about supportive of flexible work, and would they themselves utilise it? So it is very much surrounds their interest in flexible work for themselves. And as the data I presented, both men and women did actually indicate they were interested in flexible work for themselves. So we don't have necessarily whether they would like it for each other. But I think, optimistically, if people are looking for it for themselves, hopefully they also support it as a workplace practice across the board. But I think it is significant that there is growing support for flexible work from both genders, that's awareness. And we know from the literature that it isn't enough just for women to be given parental leave, or for women to have caring responsibilities, to have time off for caring. Actually, it makes a huge difference to workplace performance, to family well-being, and certainly to child well-being if both parents, both male and females, are able to take time off from work for other commitments. So it's really great to see that kind of support for more flexible work from both men and women.
I might just add there, thanks Amanda, that's really interesting. It's really interesting actually in light of the study we're planning to do on childcare, because one aspect of that will be looking at how does childcare responsibilities affect working parents, the mothers and fathers. So maybe we can look a little bit further into that question of flexible working and what's needed there as part of our study. So let's definitely connect on that further.
And I think some of the information that you get out from that study, we'd be very interested to know. And so just because we're on the topic of childcare, there's a question from the participants. They're asking for you, Ellen. Are you anticipating any distinct challenges during the introduction of childcare in workplaces in PNG compared to Fiji?
Yeah, so actually when I talk about childcare, I don't necessarily mean about opening up a childcare centre in every workplace. So when we look at childcare interventions, They could be as simple as putting in place flexible work policies or breastfeeding facilities in the workplace, or perhaps other alternative support for working parents. It might be that there's a subsidy provided, that type of thing. So what we've seen in other places is that actually the impact of putting in place some of these simple measures around flexible working, for example, can have a really enormous impact on parents' interest in staying in the workplace, retention in their jobs, turning up to work every day, and also reduces absenteeism. So I think there's some really, really good opportunities there.
Thanks, Ellen. So this next question is for Amanda. So Amanda, you mentioned in your second or third slide that there were inconsistencies of the GESI policy within different levels of government in terms of implementation. Was there any particular reason why that was the case? That's the question.
Yeah, there's inconsistency everywhere, but maybe that's situation normal in the PNG public sector. So it's not just at national and provincial level governments. There's inconsistency at levels of government between departments. So you can still see there's actually a couple of superstars that are doing really well. That have really tried very hard. IRC is a good example to try and strengthen their gender awareness, gender training, and gender and women in leadership. So some agencies were doing quite well, and I would say Treasury is really trying as well. But the reality is, across the board, resourcing is a major challenge. So whilst everyone is meant to be allocated a budget for a gender coordinator, the role is rarely filled. And the reality is a gender coordinator alone isn't going to change behaviour. Like, it's too much to ask of any one role. We all know that it needs to be something much more substantive across leadership, and it can't come down to one individual where the role is often not filled. So resourcing is a problem, level of priority is a problem, and it's just very patchy in the kind of level of leadership on GESI implementation. GESI training is also very patchy in its delivery, and part of that is where donors are actually delivering the support. There's obviously some enhanced resourcing for the departments that have access to that, but it isn't consistent across the board. And I should say that the data and the survey does have representatives from provincial level government, but the payroll data doesn't capture provincial level government and village level employees. And I think we'd see much wider pay gaps were we to reach out and include some really, there are quite a few large public sector roles that aren't in the data, which is outlined in the report. So whilst we do try and give some very positive news around some pay equity, there's still some underlying major challenges.
Sorry, one more question for you, Amanda. So for the public service GEDSI policy, what kind of training does it provide to GEDSI focal points? And are these focal points trained to share information about the policy and support public service to access? And is this mirrored across the different government departments?
Yeah, that really follows well from the last conversation. And so I think the answer is no. And also the GESI focal points, the coordinators, that they don't receive adequate training is the feedback that we're receiving to be able to perform what is expected of them. But I think one of our broader recommendations is really that we can't continue to expect these focal points to be enough. Like, senior leadership in these departments needs to be responsible for this, and you can't outsource to a focal point the role of behavioural change in a workplace. So I think that something much more than just focal point training is needed. We do recommend that you need executive training for gender, and you need a whole range of things. We make recommendations around recruitment practices, mentorships, and just the analysis around the change in behaviour that comes in gender diverse teams. It's so significant as to we can't continue to deny the potential for having diverse teams and the impact on workplace performance. People were not only reporting that they were happier at work in their gender diverse teams, they also felt that their teams were more creative, that they were open to new ideas, that discussion was more free-flowing, where there was, and it's not just about women, it's about diversity, so that you can have a diversity of views that where debate thrives. I think we know this, but it's great to have some data that actually validates it for the PNG public sector now.
Thank you, Amanda. And yes, I do agree. It's a whole of office approach. It can't be just one certain particular individual in the office that has all of that weight on their shoulder. And just to say that also the Business Coalition for Women does make an effort of working with the executive management level and then also the specific contact teams and other staff within the organizations that they work with. This next question, I think it might be for both groups to respond to, if you think you can respond to. So the question, it's about the GESI policy, but I'd also like to hear both Ellen and Shabnam, your views as well. So the question is, can GESI policy training be implemented across to all private or NGOs so that work policies in GBV guidelines and relevant work policies are recognized and amended appropriately and accordingly? Whoever wants to respond first, you can go ahead.
Yeah, I would say that's the dream. You know, that's what we are hoping for. I'm finding Amanda's data just really amazing. There is the correlation between diversity and better performance, and also important things like agency is an absolute business case for you know, cost savings, increased innovation. But what we find, as Amanda has outlined, is that people are more able to flourish personally and also do get on better. That teamwork improves, that social cohesion increases. It's an absolute win-win to be inclusive. So, of course, we would like to see this kind of work done across the public sector, across the private sector, and across non-government sectors. Ellen, do you want to?
Yeah, I would just say that I think it's really critical to have those policies in place, but policies alone are not going to be good enough. So the other thing that we've really noticed in our work, and Shabnam and I have worked with many clients over time now, is just that it's really important that the leadership of the organisation walk the talk, that it's not just a piece of paper which says the policy, but actually they're exhibiting those values in the way that they treat their staff and interact externally. So that's really important as well, that it goes beyond policy to actual a culture change within the whole organisation. But I'm really interested to hear what Amanda has to say from her experience as well on this.
Yeah, no, I completely agree. And the dream is that it's across the board. We see this change in workplaces. And like one thing that would be wonderful, and I think it is happening in PNG, is that the private and public sector, not-for-profit sector, like you can learn from each other and take what works. Obviously, that's the end goal. I am a little worried that I've left the impression, because there are some very positive correlations that GESI interventions can work, that I've implied that they're working everywhere. The reality is it is working in in the PNG public sector, where investment and effort and leadership is being shown. The great majority are not getting the benefits that we're talking about. And in fact, there is a huge gap in the amounts of effort and investment that needs to be put in to achieve some of the outcomes we're talking about. And we are talking about better attendance at work and better productivity at work, which all flows through to the things that really, for governments and for private firms, you want to see better service delivery. And that's only going to happen if we have a stronger, more capable, healthier workforce. And what we're finding is, amazingly, having women and diverse groups in that workplace help you get there. So we see it as a win-win policy, because you actually get the bang for your buck of utilising your great female human capital. You have women at work and empowered. You have opportunities to reduce violence and improve health outcomes across the board, but you also get a better functioning government. So really the question is, why aren't we doing this? Why isn't government doing it? And that's what we hope between both these reports and the work that that doing, that we see more of this, because there's just such huge need and huge.
Thank you, Amanda. Yes, I agree. We do need that leadership factor, that champion within the organization, whether it's in the government or in a private sector. We need that that group of people or an individual who is able to pick up the work that we're doing around GESI and drive it forward. And I think that that's the way that people within the workplace will feel safeguarded or ensure that their concerns are addressed. So we've come to the end of our presentation, the panel discussion. Just to confirm that our presenters have agreed and are happy to have the reports shared. So we will have that shared through Tove here on our team. Were there any last comments, any last questions that any of our panelists you had before we finally end the panel discussion?
Just want to say a huge thank you to Pacific Women for hosting this. It's been a really interesting discussion. I've certainly learned heaps, and I really look forward to reading Amanda's report. I think it's fantastic to have this level of evidence from PNG. I think it's going to be useful for PNG, but also for the Pacific generally. So really excited, and thank you for hosting this discussion.
And likewise, like I really appreciate being invited and value the work of Pacific Women. I think it's great what you do. And the one thing I would say is our research, all of this research, it is only as valuable as the take-up of it is. So fortunately, in the case of this research, it has a ready audience in informing the next policy. But as was already said, policy isn't enough. Like we need this talked about and discussed and shared. And we really hope that avenues like this and Pacific Women are a way to get more of the research out and promoted. So thanks for being part of that process. That's really helpful.
Yeah, and just to echo the messages from both Shabnam and Amanda, thank you so much to Pacific Women. This is a really, really valuable session for us, and particularly for me, being quite new to Papua New Guinea. But I'd like to encourage people who have tuned into this session to reach out. Toby will share my contact details as well. So if you want to have a conversation, we can discuss this in more detail. Thanks again. Thanks so much for having me.
Yes, thank you. And as everyone has said here, evidence is only as good as we can pick it up and actually implement. So the team here have presented some very good evidence, and it's all PNG based. So I'd encourage everyone, if you have the opportunity to read through, and then it's an opportunity for us to be actually using the evidence that they have put together for us to use. Antasol, and thank you very much.